Good morning. If you're just joining us, this is Good Morning Kenya, and Thursday is the new Friday. Before we took a short break, we're telling you why you need to be on board with us this morning, because we are talking about chapati. Chapati. And I know, yes, it's a festive season. Some of us grew knowing that if you see chapati, either kuna wageni ama ni siku ya sherehe. So we are having a party on the 18th of this month, and it is dubbed the Chapati Festival. It's not your conventional festival, because this is an event that is going to be taking place in Eldoret to raise awareness and also support to cancer patients. And it is being driven by two wonderful ladies. Among them is a cancer caregiver as well a two-time cancer survivor. You're going to be seeing them on screen, and I want to introduce. Start with the one in white there. We start with Rabecca Omolo, who is a lecturer at the University of Eldoret, a caregiver to cancer patients, as well as a chairperson of the Solace Cancer Foundation Eldoret. Good morning, Rabecca. You have seen this face before. This is Esther Andare, who is a two-time cancer survivor of ovarian and bladder cancer. She's the organizing secretary there of Solace Cancer Foundation Eldoret. Those are great. Those are our guests this morning, and they are going to be taking us through this conversation. Why do we need to participate in the Chapati Festival that is going to be happening down in Eldoret on the 18th of December? That happens to be Saturday. Good morning, Esther. How are you? Well, we're trying to get Esther there to, respond to us here in studio. Remember, we also welcome your feedback. You can get us on Twitter at KBC Channel 1. My Twitter handle is at Manyara there. We also have Rabecca Omolo, who is a lecturer at the University of Eldoret, a caregiver to cancer patients, and the chair of Solace Cancer Foundation Eldoret. So I don't know if my guests can hear me right now. Can we have them so that we can get to see them? Yes. Good morning, ladies. Well, we're trying to good morning, ladies. Good morning, Esther. Good morning, Rabecca. Well, let's take a short break. When we come back, we'll have rectified that particular technical hitch, and we'll be talking still about matters chapati and why we need to be part of this Chapati Festival that is going to be taking place on the 18th of December down in Eldoret, to not only give an opportunity to share, but also create matters of awareness around cancer and how to support cancer patients. We take a quick breather. We'll be right back. Good morning once again. If you're tuning in, you're watching KBC Channel 1, and this morning we're talking about matters of entertainment as well as informing you. We're talking about the Chapati Festival that is going to be taking place on the 18th of this month down in Eldoret. It is being driven by two remarkable women who have a story to tell. This Chapati Festival is not just about sitting and making merry, but also creating awareness around cancer and drawing support for cancer patients and survivors. Introducing my guest this morning, we start off with Rabecca Omolo, who is a lecturer at the University of Eldoret, a caregiver to cancer patients, as well as the chair of the Solace Cancer Foundation Eldoret. Good morning, Rabecca. How are you?
Fine, thank you, my dear. I'm fine.
Great. And on her left or right, depending on how your screen, or rather placement of your screen, is none other than Esther Andare. Esther Andare is not an alien face here. We hosted her while we were doing the Eldoret Sundowner chapter as KBC. She is, the lead person in the Eldoret Sundowner chapter there. And Esther is a two-time cancer survivor of ovarian and bladder cancer, and she's the organizing secretary of the Solace Cancer Foundation Eldoret. Good morning, ladies, and welcome to the program.
Thank you.
Thank you.
Let's start off with you, Esther. Tell us more about the Chapati Festival.
The Chapati Festival is a feeding program. Basically, we are trying to get the cancer patients, the cancer survivors, and their caregivers together in one place so that we can create more awareness of the disease, and also to try and get some kind of help for them through a program we have dubbed Adopt a Patient. So the rest of the members of the public are all invited, including the county itself, so that anybody who is willing to adopt one patient can adopt a patient and help them in one way or the other through the payment of NHIF, paying for their medication, or basically just walking the journey with them.
So, Esther, you can shed more light. What was your inspiration around the Chapati Festival, and why Chapati Festival? Why not Pilau Festival?
Regina, people love chapati. So if people hear chapati, they are excited about it. They come in huge numbers. So that was the main aim of calling it Chapati Festival. We've done it before through the Sundowner Eldoret chapter for the street kids, and I knew this one would happen again now for the cancer patients. Basically, after the journey I've had, and the first time having not had anyone to walk with me, and then the second time I had the whole Sundowner fraternity, including the KBC, working with me the journey. So my inspiration towards this event is because I want to have these people feel the same way I felt when I had people walk with me throughout this journey, so that they also get to have people who can help them walk the journey like I.
Thank you very much, Esther. As KBC and part of and parcel of the Sundowner group, I was down in Eldoret, and I quite remember people came together to just stand together and ensure that you walk this journey not feeling lonesome. I want to introduce Rabecca Omolo. As we said, she's the chair of the Solace Cancer Foundation Eldoret and a caregiver to cancer patients. Rabecca, good morning once again.
Good morning to you, my dear.
What is your feel around the Chapati Festival, especially from a point of view that you are a caregiver to a cancer patient, the need to walk that journey? I think,
Chapati Festival would do so well for a caregiver, and because it is the only festival or the only organization that we have brought together different caregivers. So to me, it's a day for us, the caregivers, to be able to marry, to be able to share our experiences, to be and so it is a day for the caregivers to just marry around with the cancer patients. Hello. And you see,
please proceed.
Yes, when you talk about the caregivers, necessarily all of us, since to me, cancer has become, in fact, a national disaster. You should know what it entails to walk the journey with a cancer patient. So it's our day for all of us.
Mm-hmm. Now, bring it back to Esther there. Tell us, if I wanted to participate on the Chapati Festival, if I wanted to participate, how would I go about it, Esther?
If you wanted to participate, what we are doing is anyone is welcome to come in. Anyone is welcome to coming in the event. But also in the case where you cannot come in the event, we have a till number where you can send any amount you feel you can help with. But basically what we are trying to drive in is that we want any person to adopt one patient. Any person can adopt one patient in any way they can. As we speak, I have about 30 members, 30 people who have come out wanting to support a cancer patient each. And they have all told me they want to pay in one way or the other NHIF. They want to pay in one way or the other a chemo session. They want to pay in one way or the other a radio station. So we already have this thing going as we speak. And that day is basically just to formalize, introduce them to the patients they are supporting. And if they can't, we are offering the names of the patient to them and their ID numbers so that they can pay in through their accounts for the NHIF in any case.
How far is the reach in terms of assistance, Esther? Does it just target, cancer patients only in Eldoret, or is the reach national-wide?
It is national-wide. The thing is, we found that when it comes to the Western region, it's a bit different because you see the ones in Nairobi get to benefit more than the ones in the Western region. So this was basically to reach out to the ones down the Western region. I'm talking about the Kisumu counties, the Bungoma, Busia, Kitale, those sides. And because we have also traversed these counties ourselves, we have met those people who are affected in one way or the other, whether they are sick, whether they are caregivers, and they have no way of getting assistance because of financial constraints or because some of them are even afraid of the treatment itself and the myths that are surrounding cancer as a disease. So with that in mind now, we are basically targeting the Western region more, although now we are not closing ways to the rest of the country because we also have people from Nakuru County coming in, people from Nyeri County coming in one way or the other. So, but basically we wanted to reach out to the Western region who have not had foundations supporting them much more like the Nairobi County has.
You have mentioned that it is open for everyone to participate. Maybe you can tell us how then, which till number, you mentioned a till number so that even our viewers who are watching this morning and also, we are streaming live can also be part of this particular noble exercise. Maybe you can read to us the till number.
We'll talk more about the till number and how to channel in the funds. Mm-hmm. But we are encouraging really people to come out in huge numbers because you see, the physical appearance of people supporting these people is much more than the financial bit of it. These people have been stigmatized. And they feel alone. Most of them, even as you check the data, you find that mostly women are the ones who are abandoned by their husbands and they are abandoned by the community itself. There are people who have been driven from their homes for the same. So basically, it's that feeling of belonging and the feeling of knowing that there are people who love them regardless of what they are going through. And that is what worked for me more. Because you see, I had a huge number of people supporting me, And for that reason, it was like I was walking the journey with them. And because I didn't feel so much like I was alone, it was much easier for me to go for my sessions, to accept treatment. And basically that's how I fought it.
Thank you for sharing, Esther. Indeed, Esther, you are our champion there. Esther Andare is a 2-time cancer survivor of ovarian and bladder cancer, saying that we need to support persons who are, cancer patients and walk the journey beyond the financial support. I want to bring back Rabecca Omolo, who is a caregiver to cancer patients, to just give us her take in regard to, just walking this journey with cancer patients and what impact it has on their overall, getting or overcoming cancer, because we know that there are survivors such as Andare who need this much support, and it goes a long way. Rabecca, what is your take from a caregiver point of view in regard to, walking this journey to recovery by cancer patients? Rabecca.
Number one, I'm telling you, to walk the journey with a cancer patient is just a painful experience. As they go through it and you're together with them, it's just a painful experience because you see their suffering. For instance, even
it seems you're yes, you're back on.
Do not have those in the community. Can you hear me?
Yes, we can.
Yes, taking care of those in our community who do not have people to walk the journey with them. It's so painful to see any assistance. So it is so traumatizing. For instance, getting a patient deep down the village with an open wound, and just this person waits to die. So this has really touched our hearts, and we feel that we just need to have a voice of people coming up together so that we can sensitize them on the importance of walking the journey with them. It is equally draining, physically, emotionally, financially. It is so draining because, you see, you have to be there for that person. Given, for instance, if somebody is your wife, your husband, you have to be there for them. And you see, very few of us do that. So it is draining for the person who is walking the journey. Financially, we need people to support. Sometimes we lack that support. As cancer patients, they lack the support. And that's why we are coming together as Solace Cancer Foundation, so that we can mobilize people to know that cancer is a national disaster, and cancer needs you and me to even pay NHIF, to assist somebody with NHIF, to give somebody food when they are down, to give them even a fruit when they are down. So it is just a very heavy burden to the few who are walking the journey with the cancer patients. And yet I know in our country, we can really do it. Just imagine, even in the Chapati Festival, if we had maybe the leadership in the county, even outside the county, coming to adopt one patient each, I'm telling you, it will have eased the burden of the family going through it.
Thank you very much, Rebecca there. Before I release you, Esther and Rebecca there, I would want to give an opportunity to you, Esther, to just tell her exactly where this Chapati Festival is going to be happening and how we can reach, or rather our viewers can reach, the Solace Cancer Foundation Eldoret Center there to just get more details as to how to participate in this noble feat there. Esther.
Well, the venue of the Chapati Festival is at TAC Center. TAC Center is behind Zion Mall, which is the ground used by Central Primary School in Eldoret. And it's on the 18th of this month, this coming Saturday, from 9 a.m. up to 5 p.m. Majorly what we are doing is the feeding program goes on, and then there'll be games where any member of the public will be required to pick a patient and play the games with, basically outdoor games. And then there'll be a bit of dances. There'll be a bit of testimonies from the cancer patients, some of the survivors themselves. There'll be free screening on that day from some of the hospitals in Eldoret, especially Eldoret Oncology providing the same. There'll be screening of other types of diseases with Christopher Clinic coming in for the ENT screening. We have Real Hospital also coming in for general screening. We have Mediheal coming in for general screening as well. But basically what we are aiming at is the free screening for cancer, for cancer, whereby anybody is welcome to come and screen for breast cancer, for prostate, for all kinds of cancers. There'll be those services available on this day. So we are encouraging everybody to come in any way they can, even if not for the patients or the survivors, just for themselves, for the part of the free screening. It's a good way to take advantage of the service provided that is free, which otherwise would be charged for if you went to the hospital.
Mm-hmm. And a closing remark, especially now to a person who has maybe been diagnosed with cancer, someone who is already going through the treatment, the chemo, the radio, and all that. One encouraging word, given that you are a 2-time cancer survivor.
I always tell people all the time that cancer is not a death sentence. It is not the end of life. It is just like having a cold, having a headache, which after some time, if you treat it in the proper ways, just goes away. And also how you accept it in the way that you embrace it is also different, because when I embraced it, I knew this is the second time I would have easily given up and said I cannot do it again. But you see, acceptance is more important in the beginning of healing than any other thing. So what I can just tell them is cancer is not the end of life. There's much, much more ahead. Even as you go through that treatment, you are not limited in any way in going about your daily activities. So it is the courage, it is the test of courage, it is the test of resilience, it is the test of basically anything about life. And the way you accept it, that is how you start healing.
Thank you very much. That has been one of our guests this morning as we're talking about the Chapati Festival. That is Esther Andare, who is also an avid sundowner, KBC English Service listener there. She's even the chairperson of the Sundowner Eldoret chapter. And now she's coming in to just raise awareness about the Chapati Festival. That is a function, or rather a sensitization function that is going to be taking place on the 18th of December down in Eldoret to raise more awareness on matters cancer, and more so to help members of the public, adopt a cancer patient and ease their burden. You can pay for a month on NHIF, or shop for a day, or even pay for medication. This is also going to be an opportunity for you to get screening for cancer, all types of cancer, as well as general screening. So indeed, the TAC Center is going to be hosting the Chapati Festival come Saturday the 18th. She was joined by Rabecca Omolo, a lecturer at the University of Eldoret, who is a caregiver to cancer patients and the chair of the Solace Cancer Foundation Eldoret. Further details would be availed on our website, that is www.kbc.co.ke, and also you can reach their page, Solace Cancer Foundation, to get further details. You're watching KBC Channel 1, and I'm Regina, Manyara, and Thursday is the new Friday. We take a quick break. When we come back, it's all going to be about matters entertainment.